Hey, how are things going? Did you try the supplements? She's like, yeah, I don't have time for that. I was like, what do you mean? And she's like, I don't have time to go to the bathroom that much. I'm busy. And she never came to see me again. She was not terribly happy that I made that inconvenience in her schedule that she has to spend more time in the bathroom. And I thought that was pretty funny. Also, she had four boys as sons, so I was just also confused at how the topic of poop didn't come up more often. Hello, everyone. My name is Allie Virtue, a functional medicine nutritionist, and your host for the Pre-Diet Podcast, where we are unlearning the diet rules and rewriting the healthy living playbook so you don't feel like you have to start another random diet on Monday. We're going to stop that cycle. Today's episode is a very special episode that hopefully doesn't make you too uncomfortable. If we have met in person, especially at a professional networking setting, you might have heard me remind people, my peers, to poop every day. I like to break the ice early on, and if I can do that while also giving a healthy PSA to everybody that they should actually be pooping every day, it's just a great way to, really break the ice and get people chatting. So, I'll get into that story hopefully in a little bit, but I do want to normalize this topic and give you a lot of valuable information in this episode. So, buckle up, definitely listen all the way through. There's tons and tons of information that can really help you out. Or maybe you can send this to a friend saying, oh man, I just feel bloated, constipated, I can't poop to save my life. This would be a great quick listen for them as well. So, I wanted to start with a quick statistic about constipation. A little fun fact, if you will, but approximately 16% of the adults in the US suffer with constipation. That percentage increases to 33% if you're over 60 years old, and even more so in women versus men. Shocker. But if we actually define constipation, it's defined as fewer than three bowel movements per week. Now, when I read that definition, when I talk to people, if they're not going every day, they feel like they're typically on the constipated side of things. Now, everybody has what is normal for them, and we can dig into that a little bit more if we need to. But in general, this is hard, dry, lumpy stools, straining or pain during bowel movements, a feeling of not completely passing the stool, bloating, abdominal discomfort, things like that. So, why does constipation happen? Well, there are a lot of general, quote, root causes. It's usually not one thing in particular, it's usually multiple factors contributing to that result or that symptom. Hey guys, just want to jump in real quick. Thank you so much for listening to the Pre-Diet Podcast. Before you go any further, please consider giving it a 5-star review and subscribing to the Free Shit Friday email list to get one recommended recipe, to get one tip or tool to help you along your health journey, and one question for you to ponder over this next week. Thank you so much for being here. Now back to the episode. One of the most common root causes for constipation, I would say, probably is low fiber intake and dehydration. Those two in particular, I just see it so commonly. It's really, really common for standard Americans to be dehydrated and not consuming enough fruits and vegetables, which are our main sources of fiber. Lack of movement or sedentary lifestyle is another really, really big one. This comes up a lot when I've worked with clients that don't necessarily have a weight loss issue, but they do have gut issues. And some people might think that, oh, well, they don't have a weight loss issue. That's not really the case. When you read a lot of research as far as like how can we improve someone's gut when they have, like a chronic gut condition, exercise is on there. Exercise absolutely helps with those issues. And part of that is increasing circulation, increasing the better nutrient delivery to those tissues through circulation, through movement. But also the gut really thrives off of movement as well. It helps things move along, not just the smooth muscles within our guts that help move things along, but gentle movement throughout our day and exercise really helps move things along as well. So movement is really, really critical when we're looking at this issue too. Gut dysbiosis was just a fancy word for imbalance in our gut bacteria. Hormonal shifts. This is mostly when we're looking at like low thyroid function, which tends to like, when you look at all of those symptoms, tends to like slow things down, slower metabolism, slower digestion, high cortisol or high stress. This can also be a little bit of a behavioral thing too. If people are stressed, they're busy, they're running around, it kind of disrupts their bathroom routine as well. So that can be a component. Medications absolutely play a role if you're on any type of opiate, iron supplement. GLP-1s also tend to slow down digestion. So all of those can play a factor. Also, kind of circling back to the high stress one, but it's not terribly uncommon for people to ignore the urge. This kind of ties back to the beginning when I mentioned I tell people to poop every day. And that came about from working in a primary care clinic in Eugene, Oregon. And I'm looking at this lady's chart. I'm working as a nutritionist in this primary care clinic. And I can see this lady's chart. I can see all of her diagnoses. She has multiple diagnoses already, quite overweight. And I'm asking her question after question, like, is this normal? What do you experience here? Da, 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 da. Trying to get a picture of what she deals with as far as symptoms, gut symptoms specifically, on a daily basis. Keeps answering my questions like she's totally fine, doesn't notice anything, blah, blah, blah. And I was like, this just can't be right, especially based on what she's eating and what I can see in her medical chart. And so I finally, this is a newbie mistake, but I was pretty new to this job. I finally asked her, I'm like, how many times a day do you poop? She's like, oh, I don't poop every day. I probably go like once or twice a week. And I was just flabbergasted. One, that she didn't know that that's not normal. Like I said earlier, that was normal for her. And I was like, that's not really good. And I was just shocked that this never really came up in any other of her medical appointments before, or that she should do something about that, etc. So we went over dietary changes, but I also said, hey, look at these supplements. They can also help get things moving a little bit more timely, shall we say. And she came in a couple days later to talk to the nurse practitioner about something else. And I saw her and said, hey, how are things going? Did you try the supplements? She's like, yeah, I don't have time for that. I was like, what do you mean? And she's like, I don't have time to go to the bathroom that much. I'm busy. And she never came to see me again. She was not terribly happy that I made that inconvenience in her schedule that she has to spend more time in the bathroom. And I thought that was pretty funny. Also, she had four boys as sons, so I was just also confused at how the topic of poop didn't come up more often, just from raising kids and seeing how much kids poop every day. Maybe adults should also poop a similar amount. So anyway, I thought that was awesome. I thought that was a funny story, and I will never forget it, that's for sure, because now I do remind people that they should be pooping every day. I use that hashtag a lot, hashtag poop every day. I got stickers, everything. So it's a great story. Let's also talk about some diagnoses that could involve constipation as well. So the first one, and probably most obvious, is going to be irritable bowel syndrome. So IBS, irritable bowel syndrome with constipation dominant. So this would be IBS-C. If you have constipation, or if you have IBS with predominantly diarrhea, that would be IBS-D. Or if you have a little bit of both, that could be IBS mixed. So there's a couple iterations of those, but this is typically altered gut brain signaling that our gut just has a little bit slower motility pattern. So this can be like a neurological thing. It's not just, our gut bacteria. It's not just one factor. Like you can see from our list already, we're just getting into this. This can be so many things played into this one symptom that that person might be dealing with. Another diagnosis could be celiac disease. In some people, if gluten triggers that much of an inflammatory reaction, that can also inhibit some of the motility signals going on with the gut as well. SIBO, so that's SIBO. That stands for small intestinal bacteria overgrowth. There's a couple different types of SIBO, but methane dominant SIBO can specifically kind of slow down the gut transit time as well. Like the name says, you have overgrowth of bacteria in your small intestine, and we want the largest population of our gut bacteria to be in our colon or our large intestine. So it's just a little bit of imbalance of where the bacteria actually are. They tend to ferment our food that we're eating, cause gas, bloating, discomfort there, instead of doing most of that fermentation in the colon. So that can cause some issues there. Colorectal cancer or polyps can be an actual physical block that's preventing stool from passing. Anal fissures and hemorrhoids, this can lead to pain and also doesn't really encourage someone to go to the bathroom if they're always in pain when they do go to the bathroom. So withholding is an issue, and this tends to worsen constipation because the longer your stool is sitting in your colon, the more water it pulls out of that waste and the harder that stool becomes, and worsening our problem. Endocrine or metabolic conditions that can be involved in this picture: hypothyroidism, so low thyroid function, can also slow overall metabolism, but also gut motility. Diabetes, you can have nerve damage that can affect gut function. Pregnancy, this could be due to hormonal shifts, iron supplements, or just also the shifting in anatomy, making when the body is making room for the new growing baby. You can have neurological or nerve-related conditions like Parkinson's disease. This affects the nerve signaling in our gut and very commonly causes constipation. Multiple sclerosis or MS, nerve damage disrupting bowel control. Spinal cord injuries can impair communication with our bowel muscles. Other conditions like chronic kidney disease, this can be from electrolyte imbalances or fluid shifts. Hypercalcemia, so high calcium levels can slow the muscles, these smooth muscles in our gut, and impair gut motility. Depression and anxiety can shift our hormones, which also impact our gut motility, but also depression and anxiety can easily affect our habits, such as drinking water, getting out for our usual exercise routine or movement routine, hydration, all of those habits, which can again kind of circle back to messing with our digestion a little bit. Pelvic floor dysfunction, difficulty coordinating the muscles to pass stools. And before I go any further, I want to add this really important note. If this is a recent change for you, so if you have constipation lasting more than 2 to 3 weeks, so like minimal to like no bowel movements are being passed, especially if there's blood in your stool, especially if you have weight loss or sudden changes in bowel movements, these are big signs that you should be going to talk to a doctor and getting more investigative tests from there. So if we dig a little bit deeper into one of the causes I already mentioned, which is in the context of using a GLP-1 medication, typically for weight loss or type 2 diabetes, this can slow down the gut. It slows gastric emptying, so it slows the food moving from your stomach into your small intestine, which generally increases how full we feel. So that's where people have that lowered appetite. But that slowed gastric emptying slows the motility. So our food is not even moving through the rest of our digestive system as quickly. So this can cause some constipation. Also, that other side of that medication, also with the appetite suppression, you're probably not eating as much, and this is going to be less food moving through the system. And food moving through the system, especially if we're having good solid meals or regular meals throughout the day, that also triggers the digestive system to move things along ahead. But when you have something in the morning, that often triggers your colon to contract. And that is telling the body, like, hey, food is coming in. I need to make more room for this food. I'm going to evacuate the bowels or get these things moving so I can make more room. So if we're not eating as much, or maybe we're doing really long fasts and then having our first meal later in the day, that can also mess with the timing and mess with the stimulation, just the signals that are going on throughout the gut to really keep things moving in a timely manner. So even in the context of using GLP-1s, we really want to make sure that we are consuming enough fluid. We really want to make sure that we aren't skipping meals, that we're having regular meals, even if they're a little bit smaller. We want to be conscious that we are consuming fiber, even if that's from a fiber source like a fiber powder, but also really including those high fiber foods as much as we can. It is hard when we're really not hungry because those foods that are high in fiber are typically really filling, but still just being really strategic is to include as much fiber as we feasibly can or that's practical for us. Quite often, when our appetite is low, it's really easy to go for convenience-based foods or processed foods, and this again can make constipation a little bit worse. So really want to keep the water up, really want to increase the fiber, have regular meals, and definitely including some movement to help our digestive system move along as much as possible in these scenarios. So you can probably see that there's a lot of different factors that go into this one topic, and the way that I teach my group program, everybody's on the same page as far as the habits that they're doing. We personalize it to the person, but our 5-point framework works really well for addressing this type of issue because it allows you to look at multiple habits and kind of see what your weakest point is and how you can address it holistically instead of just say, oh, I'll just have a fiber supplement. That'll fix my issue. We're going to look at the whole picture. So these 5 points are water, and this could be half your body weight in ounces. So if I'm 140 pounds, my water goal would be at least 70 ounces per day, more if I'm sweating or exercising a lot. Walking at least 15 minutes per day. This is kind of a minimum that usually people can't really come up with an argument against. So if you are a fitter individual or you need to walk more based on your specific health goals, absolutely do that. I would say for optimal digestion, walking after meals is great for blood sugar, great for digestion. I'm also a really big fan of walking first thing in the morning and before bed. I think it's just a great way to start the day. You get outside, you see sunlight, it helps regulate your whole system as far as circadian rhythm. Also gets the bowels moving first thing in the morning. And after dinner or before bed is great because I don't know if you've seen the social media trend a while ago, but fart walks. Going for a fart walk is an excellent idea. It allows the bowels to kind of move. You get some gas out. You might trigger or make room for another bowel movement, but it's a really great habit to do. Also, if you're going for a walk after dinner, people usually tend to eat a little bit less because it's not as much fun to walk when you're really full. You can also just aim for overall step count for the day. If you know what you currently are walking, I would say add about 2,000 steps to that and build from there if you have a really low step count. But otherwise, 8 to 12,000 steps per day usually is pretty adequate for people. Our next point is to exercise 30 minutes per day in an intentional way. So this is generally something that gets your heart rate up, preferably gets you sweaty. This could be another walk, but it's an intentional exercise walk. So we're moving and grooving for at least 30 minutes. Now, this also might be a CrossFit class for someone else. This really depends on the person and how active they already are. The next point is sleep. So this is really our time to rest and digest. And ideally, these my group members are getting a point or checking that box off for the day if they've gotten at least 7 hours or more of sleep. This is really important because this is the time where your gut gets to rest and digest. This also helps us lower stress, which allows us to better digest our food as well, and usually makes the other healthy habits a lot easier if we're managing our stress well. The last point of the 5 is logging our food. So this allows you to really learn about what you're eating. How much fiber are you consuming? Are you consuming too much fat or protein? Is that slowing your digestion down too much? Where do you get your fiber from? Are you getting a variety of fiber sources? Do you have solid meals? Or are you just kind of snacking all day? This is really important because, again, having those solid meals or regular meals throughout the day is really good. Your body loves routine. So it's not that we can't, disrupt our routine occasionally. That's fine. But ideally, we're feeding ourselves on a regular basis. And this can really help trigger that gut motility by having those regular meals that trigger our gut to keep moving on a timely manner. Water between meals can also be helpful because this can allow us to digest our food a little bit better and not necessarily dilute all of our stomach acid and digestive enzymes with a ton of water. You can absolutely drink with your meal when you naturally feel thirsty, but you don't want to drink necessarily a 40-ounce water bottle with our meal. That can inhibit digestion a little bit and cause some bloating. Next, let's talk about some foods that can be really helpful versus foods you may want to limit. So these are some constipation-friendly foods. So high fiber fruits like berries, pears, kiwis, prunes, vegetables, especially leafy green vegetables, broccoli, zucchini, legumes, lentils, chickpeas. If you tolerate those well, sometimes they'll cause a little bit of gas and bloating for some people, but these are really high in fiber. Whole grains like quinoa, oats, brown rice. Again, that might depend on how many carbohydrates somebody is tolerating at that particular time, but generally those are also high in fiber. Healthy fat sources like avocado, which also have a lot of fiber, chia seeds also have a lot of fiber, flax seeds, they need to be ground flax seeds though, but those are also really, really high in fiber. Olive oil, another very just anti-inflammatory oil. Fermented foods like sauerkraut, kimchi, kefir are really, really good. These are pretty potent probiotic-rich foods, so foods that naturally have a lot of good bacteria. This can be really helpful for gut motility, but also introducing really healthy, good microbes or healthy bacteria into the system as well. So some foods you might want to limit depending on your issues, excessive cheese or dairy consumption. And the reasons behind this are, one, fat can slow the digestive system down a little bit. So if we're eating a lot of high fat foods, fat is just really satisfying, and it also is a bigger molecule to digest, and it can just slow down the gut transit time. Casein can also slow the gut motility, and this is generally a really good thing in the sense of like it keeps us full. If you think about what milk or dairy products are for, they're for nourishing young or, baby cows or infants basically, right? So it's supposed to help them grow. It's supposed to help them be nourished and satisfied. So generally good things. But if we're consuming these things to an excess, that might not be as helpful in this scenario. So reducing those things, I like to think of a serving size of cheese in particular as 1 ounce servings 1 to 2 times a day might be a more reasonable amount. Also, if we're eating like highly processed things like fried foods and very fatty meals, again, those fried oils could be inflammatory to the gut lining, but also those are going to slow down digestion just due to the really high fat content. And you can kind of feel this, right? If you have a big, heavy meal that's really high in fat, really greasy, it can sometimes really just sit heavy in our stomach and we feel like our digestion is not moving along in a timely manner. Highly processed foods is also something that we might want to limit just because they don't provide a lot of bulk. They're generally really low in fiber, generally really high in sugar, and that can feed bad bacteria. So we're promoting an imbalance of bacteria there. But also those low fiber amounts are not going to contribute bulk to help us move that stool through our system. Fiber acts as like a broom, kind of usually sweeping things through in a timely manner, and highly processed foods are not going to have a whole lot of fiber in them. Diets really high in red meat without balancing with fiber could also be an issue, again, because those diets tend to be higher in protein, higher in fat, low in fiber, and that fiber really helps move things along. Proteins or animal meats are generally pretty high absorbed, meaning there's not a lot of bulk left to like push the waste through our system. So that's where fiber comes in. Excess caffeine, this can plain out just dehydrate you. So this is going to make your stools harder, physically harder to pass. So if we are consuming a lot of caffeine, we really need to make sure that we're doubling down on our water intake as well. Let's talk about some supplements and supportive tools if we are dealing with this. So number one that probably comes to mind for people is fiber powders. Psyllium husk is usually the most effective. I would start out with probably like 1 teaspoon, which is about 5 grams. once per day, build up slowly. We don't want to change our fiber consumption very quickly because that can cause constipation if we aren't consuming enough water at the same time. So really, really want to be slow and gradual with these changes typically. You can also use a fiber supplement called inulin. This feeds good gut bacteria, acacia fiber, if psyllium husk causes bloating for you. A little tip on timing, making sure that we take this with water and ideally separate from medications. Fiber is great to bind on to things. So if we're taking certain medications, we don't usually want to take them with fiber because it could inhibit how effective they are. But as always, when you are changing anything about your supplement or medication routine, talk to your provider first. Another common one is magnesium citrate. Magnesium citrate in particular is usually very good for increasing motility. Magnesium glycinate can also be fairly helpful. As far as dosages, about like 200 to 400 milligrams before bed is generally pretty helpful for people. If you're doing a pure magnesium citrate supplement, I would just start really slow and then gradually build up. If you start too big, too fast, you could have too loose of stools. So just start gradual. Probiotics should be pretty specific to the issue. I usually use a database called Probiotic Advisor. It was created by one of my professors from grad school, and it's really cool because I can look up specific issues. So we don't want to get a probiotic that's just generally good for maybe like IBS. If you have IBS-C versus IBS-D, that could mean that you need different types of probiotic strains. So that's what I use typically to find a very specific recommendation for the issue. There are some food-based probiotics like we talked about. The sauerkraut, kimchi, kefir are really good ones. Also Activia. Activia has some really genuinely very helpful strains that can help with constipation. So if people are not wanting to do the supplement route and they want to do the food route first, which I genuinely really recommend addressing it first with lifestyle and food before reaching for supplements. But that is a very helpful food to include is those Activia yogurts. Digestive bitters or ginger tea can help. So looking at those teas like the smooth move teas, things like that, those herbs can kind of stimulate digestion and stimulate motility and be really helpful. Let's talk about those other lifestyle factors. So we addressed them a little bit with that 5-point framework, but water goals. So we said half of our body weight in ounces. Also, while we're increasing our fiber consumption, really, really helpful. And you can kind of look at this as far as tracking our bowel movements, but also tracking how hydrated we are by what color your pee is. And preferably that first pee in the morning is going to give you a good indication. So you obviously can't drink all night, but if we do a really good job hydrating throughout the day, hopefully that first pee in the morning is a little bit less stark. Movement. So walking after meals. We could also do some yoga moves that help, yoga twists especially, and also some really deep squats. Those can be really helpful for physically helping our guts move. Abdominal massage is also really helpful. I do this probably on myself almost every day. I just feel like it feels really good after digesting a good meal. But I have a YouTube video that I can link in the description if you want to see what that looks like as well. And again, don't forget about routine. Go when you feel the urge, don't delay, don't get distracted. Try to create a really good morning routine. This is really critical for people. So even if we're doing all the other things, we need to make time for this to happen, as silly as that sounds. But I really find that people have the best balance when they have time to move in the morning, they have time to actually sit down and eat, and they have a little quiet time before they got to rush off to work. I know that probably sounds very unrealistic to people, but it doesn't have to take too long. I promise. It can just be like 5 minutes of quiet time before you get rolling with your day. But trying to find that sweet spot, that nice morning routine. Maybe it includes warm water. Maybe that's when you take your fiber supplement. Maybe that's when you go for a walk with your dog, or that's when you go to the gym, something like that. And then followed by some opportunities and time to actually use the bathroom if and when you feel the urge. That can be really helpful. So you're starting to kind of train your bowels into getting into a regular pattern as well. All right, to kind of summarize everything, we want to identify the root cause as best we can. We want to have a foods first approach, using those supplements if we need to. Want to focus on hydration and movements. Those are necessary for all humans of all walks of life. All of these basics still absolutely apply, and then some if we are using a GLP-1 medication, because we know that slows down our digestion a little bit. Still try to make the most of your meals, even if they are smaller. And then let's think of something, if this is an issue for you, what can you do this week? Is that adding a little bit of, maybe a tablespoon or so of chia seeds or ground flax seeds to a meal, or your yogurt, or maybe it's going to get Activia yogurt or something along those lines. But think of one habit that you can introduce this next week that can help your gut health, help your constipation if that's your issue. And lastly, if you enjoyed this podcast, please consider giving it a 5-star review right now on Spotify, or give it a thumbs up on YouTube. Make sure you follow the show wherever you are listening to it. you feel like this is good information, please consider sharing it so we can spread this good information to those who need to hear it. And lastly, please, please, please subscribe to the Free Shit Friday email list at parksidenutrition.com/subscribe. Thank you so much for listening, and I'll see you on the next one.